mother can influence to congenital malformations. But one of the causes is vaccine. As you see, now scientists in the world who can analyze in the fat tissue and in the blood the level of dioxin. And in the south of Vietnam, some of the patients, we send the specimen to American, to United States and Holland to analyze the fat tissue, to detect in the fat tissue the dioxin level is much higher compared in the north of Vietnam.
In north of Vietnam or south?
Yes. Mm-hmm.
Is it north or south where the dioxin content is higher?
Yeah, in the south of Vietnam, the dioxin content.
This little baby here doesn't have legs.
Yeah.
What causes that? Do you know?
It's malformations.
Malformations. Yes.
Maybe it's caused by dioxin.
Maybe, but we don't know for sure. Mm-hmm. Are their parents?
But we make one result. We compare two groups. One group on the spray area and one group in non-spray area. And we found out that the rate of malformations in the spray area group is much higher compared in the non-spray area.
Which way do you want to go, doctor? Who pays for those children to be here?
Here?
Yes.
Hospital, direction of the hospital, and sometime in the from the OGN organization, non-governmental, give us the finance and to nourish.
Is this an older child?
11 years old.
11 years old. Are they two children?
Yes.
Yes, the Siamese twin.
There are twins here?
Yeah, Siamese twin. In 1988, we had operated successful in this hospital.
Where is the other
His
twin?
brother goes to school now.
Goes to school now?
Yeah, very clever and very intelligent. And he had unconscious because encephalitis.
Is he?
For 4 months in Japan, for treatment in Japan.
Is he aware that we're here?
He was in Jarai-Kongtum, he was born in Jarai-Kongtum province.
No, I'm sorry,
Yes.
is this young fellow aware that we are here now? Can he see us and does he understand?
No,
No.
only here a little, but he unconscious. Yeah, unconscious and he understand everything.
Where were the twins joined? At what point in their body were they joined together?
Yes, because the Siamese twin only one anus, one sphincterus, one genital system, two legs only, each one leg.
When were they separated?
Separated.
At what age?
Yeah.
What age were they separated?
9.
At 9?
8. 8 years.
Eight.
Very difficult operation.
Difficult operations. It's perfect. This is super. The operation.
You did the operation here?
Yes. This is super.
Now what is this group?
Maybe with malformations.
You see?
How old is he?
Mấy tháng, mấy tuổi đấy?
Mấy tháng?
Thằng đó.
Bé đấy. Em
đấy. 16 tháng. Đó. 16 years, 16 months.
16 months old?
Yeah.
Did their parents bring them here, or do you know?
Yes, sometimes come. Yeah.
Is this hard for nurses like this to work with all the time? Work with children that are
Yes, the nose is always here.
Is it difficult though?
Difficult because he has the maxillaries. Yeah, no legs. Yeah.
How about the other babies? Is there anything wrong with them?
Urban dawn baby. The mother go away and
Abandoned baby. But the baby's normal?
Yes, normal.
Now, how long will this baby stay here?
1 year or 1.5 years, and after we give to the parents for adoptive.
For adoption?
Yes.
Is it hard to find parents in Vietnam to adopt children?
Vietnam or the other country, French, Germany.
Americans ever adopt any of these children?
Not yet.
Not yet.
Not yet American, but French.
French.
Germany.
Now, this child here is deformed, isn't he?
Yeah, it's heart disease. Black, short arms. Ê, con ơi, con quay cái lưng ra đây để cho họ nhìn cái thằng đó. Đó, Lan. Lan đỡ chưa? Hả? Dạ đỡ. Lan đây đỡ này hả?
What's the little fellow over here's name? The one without the legs?
Tên thằng Phúc. Phúc hả? Phúc. He is happy, but he is unhappy.
Now, how long?
The name means that happiness, but he is unhappy.
How long will he be here?
Ở đây lâu chưa nhỉ? Cái thằng nhỏ này ở đây bao nhiêu nhỉ? One year.
And then what? Will he be up for adoption?
Yeah.
No?
Không có ai.
No, not yet.
But what will happen? I mean, what will happen to a child like this for the rest of his life? Where will he be?
But I think now the arms can repair the arms for him. The 2 legs for artificial legs for him. But this maxillaries is very difficult. But he can eat easily every day.
He can eat.
Can eat. Yeah, đó. Ra đây con. Này, ra đây. Ra đây chào ông Tây đi. Yeah. Very pity.
Is there more? Is that?
Yeah, 15 cases as enough for us. Very difficult to nourish them every day, day and night. Yeah. And the nurses is very.
Thank you very much. Thank you.
Thăm bên kia. Bên thôi đi sang cái chỗ ấy thì chỗ này chỗ này không đi được, bây giờ mới sửa nhà đi xuống sang cái chỗ pha tôi thì không đi được.
What is the?
As you see, the activity of our department of congenital malformations, Siamese twins.
How often do you have Siamese twins?
So far is one Siamese twin had operated, and now one French received.
How often?
And now he is in French.
How often do you have Siamese twins here?
3 couple survive. But in the last year we have 6 couple, but 5 was died. One survived over. Very difficult. After birth, he was died. It was very severe. Yeah.
One.
He go to school now.
The brother of
His brother.
boys.
His brother.
That was his brother we saw?
Yes, sir.
This is
11 years old.
11 years old?
Yes.
And his mind functions all right?
Yes.
All right. Yeah, the mind is
His
all right.
meditations.
He can speak Japanese, English, French sometimes.
Somewhat.
Japan.
What does this hospital, in your opinion, need to make things better? What do you lack? What don't you have in the way of equipment or people?
The equipment for the malformations and for the prevent the rate of malformations. We want the condition to detect early in the pregnant women, early, or make the heritage to reduce the rate of malformations.
Is Viet?
For the result, we want to analyze the level of vaccine in the patients of high-density fork mole and cholangiocarcinoma. But until now, because one specimen for analyze very, very expensive, you see, $2,000 one specimen before 3 years ago, and until now, a little discount, 50% now, $1,000 one specimen, and so we.
Where is it analyzed? Here in Vietnam?
Analyzed, yes, in Vietnam, airline directly to France, directly to perhaps to Canada,
The specimens are sent to Canada, they're sent to France. Where are we going now?
Air France.
Air France?
Yeah.
Air France now has a flight a couple times a week.
It's very difficult, very expensive.
Expensive to send the specimen via Air France?
Where you come from?
Come from the United States.
United States. What city?
Washington, D.C.
Washington. Oh, I was in Washington 24 hours only in 1987.
For what reason?
To sightseeing.
Sightseeing?
Sightseeing. 24 hours in Washington. 1987.
You can see all the malformation in bowling that we found. Is the statistic I can...
Now, what is the purpose of this room? Why is this here?
You can see the identical balls is the malformations. The cancer.
Are these real fetuses? Are these fetuses were kept after birth or after an operation?
No, the pregnant women, pregnant, but in the uterus, no fetus, only the vesicles look like the...
But these, that is a real fetus?
Yes, and about 25% chance to cholangiocarcinoma. And if cholangiocarcinoma, if severe cases, we cannot use the chemotherapy.
Chemotherapy, yeah.
If we have not enough the chemotherapy, the drugs, special drugs.
Now, what are all these?
Malformations.
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 Why did you keep those?
First, the tube neuron defects. Tube neuron, you see, tube neuron defects. For example, anencephalus.
Anencephalus.
Anencephalus, no brain, no brain.
When were these children? How old are they? How old are these fetuses? What year?
I don't know.
Before 1975, after 1975 also.
They're before and after
Before
1975?
and after, yes.
But let me ask you again, why do you keep them here at the hospital like this? For studying purposes?
Yeah, for study and we keep only some special, typical cases only, because we have not enough of the water and not enough of the formal to keep all the cases.
And do you
Only
keep them,
some
do you ever take the
few-
fetuses out of the containers and study them, or has that already been done?